Curious about a tiny creature that can cause big trouble? We're talking about Lyme disease, a tricky ailment that's often misunderstood. Imagine this. You're out enjoying nature, and suddenly, a tiny tick bite sets off a chain reaction in your body. That's how Lyme disease typically starts. Lyme disease is a bacterial infection that typically occurs after being bitten by a tick carrying Borrelia bacteria, and these ticks are typically found in grassy or wooded areas. Tick bites are similar to mosquito bites and form tiny, itchy bumps on the skin. This disease is the most common tick-borne illness in the United States, according to the Centers for Disease Control and Prevention, and studies conducted on this disease showed that possibly 14% of the world's population could have been infected. Many people with early-stage Lyme disease develop a distinctive circular rash at the site of the tick bite, usually around 3 to 30 days after being bitten. This is known as erythema migrans. The rash is often described as looking like a bullseye on a dartboard. And the most common symptoms are rashes, fever, chills, fatigue, headache. If this disease isn't promptly diagnosed and treated, can lead to a range of complications that affect various systems in the body. Here are some potential complications associated with Lyme disease. Neurological complication, joint inflammation, heart problems, behavioral changes, skin issues, eye problems, secondary infections. It's important to note that with early diagnosis and appropriate treatment, many cases of Lyme disease can be effectively managed, reducing the risk of complications. If you suspect you might have Lyme disease or are experiencing symptoms related to it, it's crucial to seek medical attention. Lyme disease complications can vary widely from person to person, and consulting with a healthcare professional is essential for accurate diagnosis and timely intervention. The best way to prevent the condition is to be aware of the risks when you visit areas where ticks are found and when bitten by a tick to quickly remove them. And the most effective ways to prevent Lyme disease. When spending time in areas where ticks are prevalent, keep in mind wearing long-sleeved shirts, long pants, socks, and closed-toe shoes. Apply an EPA-approved insect repellent containing DEET, picaridin, or other recommended ingredients to exposed skin and clothing. After spending time outdoors, thoroughly check your body for ticks. Taking a shower within 2 hours of being outdoors can help wash away ticks that may be on your skin. Keep your yard well maintained by mowing the grass regularly and removing leaf litter, tall grass. Regularly check your pets for ticks after they've been outdoors. If you find a tick attached to your skin, try to use fine-tipped tweezers to grasp the tick as close to the skin surface as possible.